Welcome to our webinar on serving families and children, midwifery and social justice in birth. I'm Wendy Gordon. I've been a midwife for 15 years and am a proud graduate of Seattle Midwifery School. 1 year ago, I was among the first group of midwives in the US to earn a doctorate in midwifery from Thomas Jefferson University. I also hold a master's in public health from Oregon Health and Science University. I'm an associate professor and the chair of the Department of Midwifery here at Bastyr University. I'm a certified professional midwife and am licensed in Washington State, where I practice in a freestanding birth center in Seattle. Before I became a midwife, I was an engineer in an oil refinery and then a corporate recruiter. Midwifery is my third career and the one that I will do for the rest of my days. The maternity care system in the United States is in crisis. 1 in 3 childbearing people today give birth by cesarean. This rate is twice the rate that the World Health Organization recommends as the upper threshold. Our cesarean rate hasn't changed for nearly 15 years, despite multiple efforts by obstetric organizations to bring it down. Families of color experience worse outcomes on all measures, especially Black and Native American families. Rates of preterm birth, infant mortality, maternal mortality, all of these are multiple times higher for Black and Indigenous families in the United States. In New York City, for example, Black maternal mortality is 12 times higher than for white birth givers. This is 2020. The system is failing Black families, Indigenous families, and people of color. Birth can and should be a life-changing event, but mistreatment and disrespect during childbirth is widespread. These are all symptoms of a maternal child health system that has not changed appropriately to meet the needs of the population. A system that overuses technology to compensate for its inability to provide human-to-human care. Overuse of technology can actually create worse outcomes in much the same way that underuse of technology can. But there is a better way. Bastyr's Department of Midwifery has clinical and leadership programs that focus on wellness during the childbearing year within the midwifery model of care. The system has to change, and not in a Band-Aid sort of way. The midwifery model of care has been shown to improve outcomes in many other high-resource countries. We'll be following up with an email that goes a little deeper into this. Our programs focus on building leadership within a social justice framework because these inequities cannot stand. Centering the health and well-being of Black, Indigenous, and people of color in the healthcare system must be a priority. And we know from decades of research and practice that when these communities are centered, health outcomes improve for everyone. Midwifery care makes a difference. Our graduates are equipped with the skills to reduce cesarean rates, improve not only individual health, but community health, and restore optimal maternal and infant outcomes on the family's terms. The midwifery model of care rests on the fact that each individual is the best decision maker for themselves and their family. The patriarchal, I know what's best for you model of US healthcare has not worked. In our model of care, individuals are given lots of information about various tests and procedures during pregnancy. They're given time and space to ask questions and receive full answers, and then are supported to make the decisions that are right for them. We recognize that not everyone should or wants to give birth at home. or in a freestanding birth center. So this model must be incorporated within hospital systems of care as well. But individualized care makes a difference. Understanding social determinants of health makes a difference. And we believe that you can make a difference. At Bastyr University, we seek to transform the health and well-being of the human community. In our programs in the Department of Midwifery, we do this through the art and science of midwifery, through humility and leadership. We expect all of our graduates to be leaders, and we have a long legacy of leadership in our professions. The healthcare system as it currently stands is not transforming health and well-being in a positive and generative way. And this begins with birth. There is little more transformative than giving birth. And we know how this could be for everyone. All families deserve the kind of care that results in a transformative birth experience. The midwife's model of care rests on several principles that can be applied in any birth setting. We believe that pregnancy and birth are normal life processes. We minimize the use of technological interventions while recognizing that sometimes they are truly needed. We believe that midwives are experts in the care of people with low risk, healthy pregnancies. We monitor the well-being of the whole person, physical, psychological, and social. We believe in continuity of care. You should know the provider who will be with you during labor and birth. And we know that birth can occur safely in the home and freestanding birth center settings for people with low-risk pregnancies. We are trained to recognize complications and transfer to settings with more interventions when they're needed. So what does this all mean for you? Midwifery is a soul calling for many people. If you can't imagine not doing this work, you're in the right place. If you're committed to changing the system so that it works better for all childbearing families, we share your commitment. If you're ready to be a leader in midwifery and maternal child health systems, we can help you to reach your goals. It's going to take all of us. So let's get to work. If this path is calling to you, your next step is to contact an advisor. Erica Leach is our admissions advisor for the maternal child health systems and midwifery programs. So scroll down and you'll find her contact information. Thanks for listening.